An infectious diseases expert says Singapore is safe from any outbreak of measles after 5 foreign workers came down with the highly infectious disease this month. Now, the expert says there's what's called herd immunity here, as at least 93% of Singapore's population has been vaccinated against measles. Melissa Goh has more.
Sporadic cases of measles can still happen, despite Singapore's herd immunity. As of last week, there's been 69 measles cases in Singapore this year. That's almost 3 times more than the 25 cases in the same period last year.
Measles has very high transmissibility capability. So, for example, if a measles patient come into contact with another person without any immunity, that person carries about a 90% of chance of coming down with measles. We always look at the onset of rash as a marker to determine infectious period. So usually the rash will appear around about day 3 to day 5 of onset of illness. On the day of onset of rash, you count forward 4 days and backward 4 days. So those will be the infectious periods of the infected person.
Prof. Leo adds that there are blood tests to check if a person is susceptible to measles. Meanwhile, at dormitories,
there's always provision of isolation rooms and sick bays. So first of all, we need to put them, isolate the workers from the rest. Communication and education is the next thing that needs to be done. And of course, third thing, we need to spruce up the hygiene in the dormitory area where the workers live, to do a massive clean-up to make sure that it's clean enough for the workers to stay.
Must be clean, talk to must be clean, When the job sites are clean and hygienic, they can work in a better environment and there's lesser chance of them getting sick. As their employer, we will always remind our employees not to go to very crowded places.
I'm standing in front of the Sungai Tengah Lodge right now, which is one of the affected dormitories. The Health Ministry says that all 92 people who are in close contact with those affected have already been vaccinated. And as an added precaution, they will also extend vaccination to residents who are living on the same floors. Both dormitories CNA approached declined to elaborate on their cleanup efforts, but say they are working with the Health Ministry.